Live from the Washington, D.C. area. It's the Inside Scoop, all the news that our viewers want to know. Now, here's the host.
Welcome to Inside Scoop Virginia. I'm Bettina Lawton and I'm your host. And tonight we're going to talk about the Fairfax Falls Church Community Services Board. We've got some fabulous leaders from the Community Services Board with us tonight. And we're going to start off with the top of the heap, and that is Daryl Washington. He is the Executive Director of the Fairfax Falls Church Community Services Board. As the Executive Director, Daryl is responsible for a budget of approximately $180 million. He has over 1,000 full-time employees and an agency that serves approximately 22,000 individuals a year. Mr. Washington has 25 years of experience in the behavioral health care field. Prior to being selected as the Executive Director, Daryl served as the Deputy Director of Clinical Operations for the CSB, where he was responsible for all the clinical operations. Daryl is a licensed clinical social worker and holds a master's degree in social work from the University of North Carolina at Chapel Hill and a bachelor's in social work from North Carolina State University. He's a native to Fairfax. He lives in the Centerville area with his wife and 3 kids, and this is his maiden voyage on Inside Scoop. So welcome to the show, Daryl. I'm glad you could make it.
I'm glad I could make it as well.
All right, so let's talk about the CSB. You've been there for a very long time, working your way up the ranks. So what is the CSB? What does it do? Why do you stay?
Sure. The CSB stands for Community Services Board, and our primary mission is to serve individuals with mental health, substance use, and developmental disabilities that live in Fairfax County and the cities of Fairfax and Falls Church, to serve those individuals that have those issues within the community and to keep them living healthy and well-functioning lives.
So we used to, with people who had certain disabilities and certain mental health issues, we used to institutionalize them all the time, but we're getting away from that. Is that how this is working now?
Sure, that's something that's happening not just here in Fairfax, but also nationwide. We found is that institutional care really doesn't help people move towards recovery, moving towards living a life like yours and mine, that people want to live within the community.
And they're closing down, if I read these things correctly. We have big mental health disability kind of hospitals. They're closing them down, and so people who might have been gone are now coming back. Is that where we stand on this whole thing?
Well, one of the primary things they're doing is they're looking at closing all but one of the training centers for people with developmental disabilities in the Commonwealth of Virginia. So at one point in time, we had well over a couple of hundred individuals from Fairfax in the training centers, but now we're down to under 20 people statewide from Fairfax that are in training centers.
So they all came home? Does the CSB serve them now that they're back? Is that?
Sure, the CSB serves a large portion of them. Some of them live in other parts of the state, but they're moving out of the training centers and into the community. And anytime that we can, we try to have them come back to Fairfax where they grew up and then live within our community.
Okay. So what kind of services does the CSB actually provide then? You've got different folks who are coming back, different folks who've always been here.
Sure.
What do you actually do? That's a lot of employees. That's a lot of money.
It is. So, and we serve anyone from young kids just starting off in elementary school all the way up to the very old. And what we provide is mental health services. We have outpatient services. We have crisis services. We have residential services where people are operating 24 hours a day, 7 days a week. And we have many of the same continuum with individuals with substance use issues, where we will have outpatient services, we'll have residential services as well. And then for individuals with developmental disabilities, we provide less of those services directly, but we have a number of different community partners that provide services. So we provide support coordination services, which helps link individuals up with those services in the community, but individuals can get day and employment services, as well as residential services to allow them to be able to remain within the community.
So if somebody needs assistance, so do they just call up? How do they actually access the services that the CSB offers?
Sure, we'd like to have a number of different ways where people can access services at the CSB. If somebody thinks they have a mental health issue, and if they don't even want to call, they can go online and they can take an anonymous screening to get a mental health or substance use assessment online, and they can access our website in order to do that. So they don't have to provide their name or their information and things like that.
So you don't track the people who come on and take this thing
No,
through
it's
their
totally
IP
anonymous.
address
They
or any
can
of that
just go
stuff?
on there and they can get that screening, that assessment, where they can get a better idea. Do I just feeling down, or do really I have depression or some type of mental health issue going on?
So what's the website? Because you said they could go to the website. What is the website?
So the website it's a link right at the Fairfax County government. So if you go on to Fairfax County and if you type in CSB, our website will pop up a link to it. So you can get access to it that way.
Easy enough then. Okay. And so if you're not somebody, because you said you have young people and you've got the very old, and some people are not really comfortable using websites or doing surveys. Are there actual people, or is there a number they can call and talk to somebody?
So there's a number you can call. Our main referral number is 383-8500, and that's area code 703. We also have an emergency services number that operates 24 hours a day, 7 days a week. If you feel like you're in a crisis, you're in an emergency, you can call that number. And that number is 703-573-5679. In addition, if you feel like you've used too many substances and you need to get detoxification from those substances, you can pick up the phone and call our detoxification center. And the number there is 703-502-7000.
Okay, so if I am, how do I know that I need to call somebody? I guess if I've had too many different substances, I in theory should be able to figure that out. But if you just sort of generally feel down, does the CSB deal with those, or do you have to be in crisis? What defines crisis when you say if you're in crisis, you can also call?
So what I would say is, when in doubt, pick up the phone and give us a call.
Okay.
The people that are going to be answering the phone are trained clinicians, and they can ask some questions and walk you through that process. And then if you're not in a crisis, we'll try to point you in the right direction to get you the help that you need. And if you are, we'll try to point you in the right direction to get you linked up with the services that you need in that situation as well.
So what happens to the people who can't afford to pay for services? Does the CSB charge people, or if you don't have any money, can you come?
Yeah. So we operate like any other healthcare entity where we do bill for insurance. We charge fees, but we also operate on a sliding scale. So it's based upon your ability to pay. So you could pay nothing, or you could get a general copay like you and I would get if we were to go to the doctor's office for our insurance as well.
Okay, so let's talk. We've got about 5 minutes. Let's talk about some of the major initiatives.
Sure.
What are the things that the CSB is having to deal with? I know one of them has to be money, because Fairfax keeps saying they don't have any money, and you have a big agency. But what are some of the issues that you and your staff are having to deal with now?
So one of the big issues that we've been dealing with, I think, not just in the Community Services Board as a community, is our Diversion First effort. And Diversion First is about diverting individuals that have mental health issues away from the criminal justice system and getting them treatment and care. And since Diversion First started, we've been able to divert well over 700 individuals away from getting arrested and incarcerated and to our Merrifield Crisis Response Center. Our largest facility operates in Merrifield area on Willow Oaks Corporate Drive, and every day police, instead of taking people to the Adult Detention Center, are taking people to our Merrifield Crisis Response Center so they get screened and assessed and get access to the health care that they need.
So the first line in that Diversion First then are the police on the streets saying, whatever you just did, they think that you've got some kind of mental health thing going on. So
Sure.
they're specially trained to do that. Those are the crisis intervention trained
That's
officers?
correct.
Is that
That's
them?
correct. That's crisis intervention trained officers, and those are officers that get specialized training in order to deal better with individuals that have mental health issue, recognize the signs and symptoms, and then basically come from a place of caring and warmth to be able to then bring that person over to Merrifield so that we can do a proper assessment with them to see what's going on, and then what is the best way that we can provide services and help to them.
Okay, and sort of avoid jail. But the other thing that you read a lot about in the paper is opioids.
Sure.
Is that something that is affecting the CSB?
So opioids are definitely affecting the Fairfax community. You know, over the past year, we've really tried to make a huge dent into making sure people get access to care, making sure they get access to residential treatment. We've been training people in Project Revive.
Which is what?
Project Revive, it's a drug called naloxone, other people call it Narcan, and what it is, it's a life-saving medication. If you suspect somebody has an overdose, you can go in, you can get a half an hour training, and then you can get access to this prescription where you can carry around, where you can instantly give them this medication, and it can help reverse an overdose if it's going on.
Okay. And did I read somewhere that that's free? Did we make that free to people?
So for those people that can't afford it, we have it free and available for them.
Okay. Okay. So let's talk about one other thing that I read a lot about. We've got about 2 minutes left. Medicaid expansion. So there was a whole big hoo-ha,
Yes.
and the General Assembly passed something. So what does that do in terms of the CSB, in terms of the people it can serve?
Yeah.
How does that affect the CSB?
So Medicaid expansion starts January 1st of 2019. Based upon us looking at things for the folks that we're presently serving, we think around 600 individuals are going to have access to health care and Medicaid that don't have access to it now. Virginia Health Foundation did a survey, and they think across Fairfax County, in between 27,000 and 29,000 individuals are going to get access to Medicaid that presently don't have access to that care.
That's a pretty amazing number. So do they all then, do you think that not all of those people are going to show up at the CSB?
No, not all of them are going to show up for the CSB. Since our core mission is to serve individuals with mental health and substance use disorders, not all 29 or 27,000 of those folks have those issues. But you have to remember, over the lifetime, in general, almost close to 1 in 5 individuals will have a mental health or a substance use issue over their whole lifetime. So you got to think possibly as high as 20% of those folks could be looking for some type of mental health or substance use care.
Okay, and they can come and contact the CSB at the numbers that you gave us. So
That's
we're going to be
correct.
good on that score.
Yes.
So the website again is, you just have to go to fairfaxcounty.gov.
Yes.
And then search for CSB. You don't have to put the whole name in, the abbreviations does it?
If you just type in CSB, the CSB's website will pop up. You can click on the link and take it right to your main page.
All right, well, good. Well, I want to thank you so much for taking the time, I know you're very busy, to come in and talk to us, give us an overview. We're going to talk to some people on your staff.
Sure.
And get some more details on how it all goes. So thank you so much for coming.
Thank you. It was my pleasure.
I surrender, I surrender.
All right, pal. Get ready for the day, buddy.
Hey, Dad. Hey, Dad. Do we have a gun?
What's that?
Do we have a gun?
Maybe you can make retirement happen. After all, you made this vacation happen.
Double points with every purchase?
Cleverly merging promotions,
I love it.
cross-referencing travel sites, and booking all your flights with those.
Vouchers. I got us bumped.
They were like, oh. But now they're like, aloha. You aced this vacation. Now get the tips you need to get on track at aceyourretirement.org.
I tried Oxy at a couple of parties. I thought I had it under control. I didn't know it'd be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
What to expect when you're expecting
Like here.
a teenager.
Today, I'm going to show you how to teen-proof your home. First step, hide the car keys. Preferably somewhere they would never look. Challenges will come up. Be ready for them. Hi, honey.
I'm ready for the... You don't use mannequins in the mannequin challenge.
You don't have to know it all to be a perfect parent. Thousands of teens in foster care will love you just the same.
We're back to the Inside Scoop. Here again, your host.
Welcome back. This is Inside Scoop, and I'm Bettina Lawton, and I'm your host. And tonight we are talking about the Community Services Board and what it does for the residents of Fairfax County, the City of Falls Church, and the City of Fairfax. And we have going to be talking this segment with Lynn Tomlinson. She is the Deputy Director of Clinical Operations for the CSB. She oversees all the clinical services for individuals with mental health, substance abuse, developmental disparities too, I guess. She began her career with the CSB in 1994 as a behavioral health specialist and has served in a variety of positions since then. She serves on the Fairfax County and Regional Task Force for prescription drug and opioid and heroin abuse. Does a fabulous job. I've seen some of those panels. And she does a lot of talking publicly to get people to be more aware of those problems. She's also a surveyor for the Commission on Accreditation of Rehabilitative Facilities to accredit behavioral programs nationally and internationally. She holds a graduate degree in education with a focus on community agency counseling. We also have Jim Gillespie. He is the Director of Child, Youth, and Family Services at the CSB, and he's a licensed clinical social worker. He leads, as he calls them, a talented and dedicated staff to ensure that children, adolescents, and their families have access to high-quality, integrated behavioral health services and supports. Since 2015, he has led the Healthy Minds Fairfax initiative in coordinating a full range of services across multiple agencies, the school system, private treatment providers, to help children, youth, and families access mental health treatment. So, welcome, both of you, to the show. This is both your maiden voyages as well. So let's talk about youth services. So, how do we define youth? How old do you have to be? What do you offer for youth services?
Great question. I'll jump in if you don't mind. So youth, Daryl talked about elementary school age kids, so usually about 5, and then depending on the child's needs, it could go up to age 22 or 23. Generally, we serve children and youth about 5 to about 18 or 19. Okay. So, and the kind of services we offer, Daryl mentioned that we have walk-in access where people can literally walk into our Merrifield site to get an assessment and a screening. And from there we have outpatient services, so it might be group or individual, as well as medication management for kids. We also have our crisis services, which are available to youth and families. And Daryl mentioned the 24-hour number, which families could call and say, oh my gosh, there's a crisis, what should I do? Should I bring my child in? And we also have residential crisis stabilization for these youth as well. We've recently worked with Jim to expand our continuum for children to involve Healthy Minds and some of the initiatives there. So we're really excited about that.
So Jim, what is this Healthy Minds thing?
Healthy Minds Fairfax is a partnership between the county and the CSB, the school system, private providers here in our community, and family organizations like NAMI. And it has 2 main goals: to improve access to behavioral health services for kids and their families, and to improve the quality of those services across the entire community. So in doing that, we've stood up a number of programs and services, and we work very closely in cooperation with the Community Services Board.
So let me ask this, because I just find it amazing. I mean, everybody knows teenagers are impossible, and so you can understand behavioral problems there. But 5-year-olds, I mean, that's so young. And what do you do? I mean, you talk about medication and all of that. Do children that young actually end up taking medication?
They can, and there's several. One of the things that the Community Services Board really likes to do is utilize evidence-based best practices. Okay. So meaning practices that have been studied and have been proven to be effective. And with children that age, a lot of the intervention would be family therapy, possibly medication, play therapy. So there are people who specialize in serving children that age.
Wow, that's just kind of amazing. So what else do you offer? So you do this Healthy Minds, and then you've got therapy. What else do you do in terms of outreach? How do you reach these? Is this all done through school systems? Do people come in separately? How do you access the youth?
A little bit of both, a lot of both actually.
Okay.
We work very closely with the school system. We work hand in hand with the school social workers, the school psychologists, and the school counselors, so that many, many kids and families get referred to the Community Services Board from the school system. We're also out in the community. We're doing direct outreach to families through linking with the faith community, through communications through social media, and every way we can think of to reach out to kids and families all across our community. And we're really trying to address the challenge of reaching out to families of diverse cultures as well, and recognizing that one size doesn't fit all when it comes to get messaging out to families in the community.
So do you have people who speak the languages that sort of dominate other than English who go out and talk to people in their own communities?
We most certainly do. One of our programs, we have wellness, health promotion and prevention programs, and we literally do go into the communities, and we do want to have bilingual and bicultural staff. I wish we had more bilingual and bicultural staff, but we do have folks who are bilingual and bicultural who do go into the communities. We do a lot of health fairs. Daryl mentioned, that we are a healthcare entity, and we are. Behavioral health is a healthcare entity, and so we're really trying to make those inroads with our teams.
Well, let me ask you this. I mean, how do you know if your child is in crisis or this is just normal growth? I mean, I think I've had teenagers, I know you have a couple. There are definitely times where you sort of say to yourself, oh, this better be a stage, right? I mean, how is a parent, or anybody else for that matter, sort of interacting with children? How do they identify if there's actually a problem, or this is just, your kids need to blow off energy, and they're not hyperactive, they don't have any kind of issues, they're just
So what we would look at is the degree to which that behavior interferes with one's level of functioning. So for kids in school, it would be, are grades starting to fall off? Somebody used to love to play football. Are they no longer playing football? Someone really liked their musical instrument. Are they changing that? Are there drastic mood changes? I know exactly what you're saying, but sort of beyond the pale that are much more frequent, and you just really are wondering. And then really kind of when in doubt, please pick up the phone and call. Call the 383-8500 number and say, this is what I'm experiencing, what do you think? Or bring your child to the walk-in assessment.
Now, can a child, because there are some families where the kid is really not going to want to, for whatever reason, or maybe the family culturally is not going to support any kind of mental health or substance abuse kind of intervention. Can they come by themselves, or do they have to have a parent because they're minors? I mean, how does that work?
So we have had a few kids who do come. I believe, and I'm sorry I don't have the exact age, but I believe around 14 can come and have their services on their own. If a child was concerned, I would encourage them to come, and then we could assist the young person in working that through with their family, with their culture, whomever.
Okay, so you can do that.
So we wouldn't want to put up any barriers to anyone requesting assistance.
And so, like, Jim, do you go out into the community? I mean, I'm thinking of, I spoke to a Rotary Club today. So do you are you guys open to coming and talking to Rotary clubs, church groups?
Absolutely.
Pretty much anybody who asks you kind of thing?
Yeah,
yes.
Our next big event will be the Fairfax County Public Schools Mental Wellness Conference on September 29th at Fairfax High School. Tremendous opportunity for parents to learn a lot about mental health issues for kids. And so we'll be there, and yes, we'd like to get everywhere in the community and talk to people, whether it's Rotary clubs or faith community organizations. We'd love to do that.
So how would somebody watching who wants to make that invitation, how do they do that? How do they Because the CSB, as we learned when Daryl was on, has 1,000 people at it. How do they get to the folks who will do these kinds of presentations? Is there a website? Is there an address? Is there a person? How do they do that?
So I believe on our website, with the opioid information, there is a place to request a speaker. And certainly if someone requested a speaker and wants something other than opioids, that could certainly be fine.
Be fine too.
So
Okay.
yes, we, as Jim said, we would love to come out.
Now, next month, I see on the news, is Suicide Awareness Month.
Yes.
And there were a number of years ago, and not actually so many years ago, there were a lot of suicides in Fairfax County Public Schools. And so what does the CSB do in that area in terms of suicide prevention? Is that a separate kind of thing, or do you just...
I am so glad you asked. So that is really something. So clinically, we have risk assessments all through our programming so we can assess youth. And also, though, before a child gets there, we really do want to promote that there is assistance. So we've partnered with PRS, which I'm not remembering the acronym, my apologies, but to have a text line so that teens can text. Because maybe the teens don't want to pick up the phone, but they want to text. We also have cognito trainings so that people can go online, go onto the website and just hit cognito or suicide training, and you can really go and learn about what is appropriate to say to someone who is talking about, I want to hurt myself.
Right.
And just contrary to some belief, it's not going to make someone want to hurt themselves if I ask them. And so I wanted to get that out. But these trainings, really, they show avatars who, if I make a wrong intervention, the kid puts his head on the table. And so I certainly don't want to do that. We also have mental health first aid. And we would encourage any person to take mental health first aid. It's just like when, I would need to know about, if someone falls off this chair, how could I help their ankle, or what do I need to do? And it really teaches people how to work with someone who may be experiencing a behavioral health issue.
It is. I will speak for that.
Please do. Thank you.
Took that. I'm certified in mental health first aid.
Wonderful.
And it was truly eye-opening to take that kind of training. And it was very interesting, and people really, it takes a while. It was like an 8-hour training, but it was well worth it.
Well worth it.
Well worth it to do. So is there a specific youth phone number, or is it just part of all the other phone numbers?
The main number.
It's the main number. Okay. And if they go to the website, the fairfaxcounty.gov, and go to CSB, is there a separate section for youth that you can just go to?
It would talk about some of the services for youth. So, and all the information, thank you for asking, we've talked about is on that website. So the cognito training, mental health first aid, etc.
All right, well, I want to thank you, Lynn and Jim, for coming and talking about the youth services that are offered. It's a great opportunity. If you have a child who needs help, call, get help. Thanks.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help. And slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
What do you think you're doing, Kevin?
Was just gonna drive home.
There are several warning signs present that you shouldn't be driving.
Like hearing voices?
Like your text-to-emoji ratio?
Oh man, the selfies.
Selfie. Nailed it.
We all have warning signs that let us know that we're probably not okay to drive. Mine is pretending to be your subconscious.
Craig, come on man, let's split a ride home.
Being a dad is an adventure full of special moments.
A cruise?
Right.
Unexpected moments.
I got this.
And even awkward moments.
Okay, Dad, thank you.
But every moment you spend with your kids, even the smallest moments, can make the biggest impact on your child's life. So take a moment to be a dad today.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys.
and then she hides them in that basket by the door. You know, but it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, you know, she's putting them in the same basket again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
We're back to the Inside Scoop. Here again, your host.
Welcome back. I'm Bettina Lawton, and I'm your host. This is Inside Scoop, and tonight we are talking about the Community Services Board, and we just talked about youth services. Now we're going to talk about adult services. So we have with us Georgia Bachman. She is the Director of Behavioral Health Outpatients and Case Management Services for the CSB. She's a licensed clinical social worker. She is passionate about suicide prevention and supporting families with loved ones who have serious mental illness and substance abuse disorders, and providing state-of-the-art community-based treatment services for those in the most need. Georgia has an undergraduate degree in psychology from the University of Michigan and a master's degree in social work from Virginia Commonwealth University. We are also joined by Peggy Cook. She is the Director of Residential Treatment and Detoxification Services for the CSB. She oversees 4 residential substance abuse and co-occurring treatment programs, a large residential detoxification center, and multiple supervised and supportive housing programs as well. She's worked with various stakeholder groups to increase awareness of substance abuse, and in particular the opioid addiction. She has organized and spearheaded the training of nearly 1,000 people for naloxone opiate overdose reversal to save lives. She is a licensed professional counselor and a licensed substance abuse treatment practitioner, and she has been in the field of addiction and mental health for 30 years. So I want to welcome both of you, Peggy and Georgia. And it's great. I want to find out about these adult services. So we've sort of heard about youth. What can we do in terms of adults? What does the CSB offer?
So the journey through our adult services begins with screening and assessment, where an intake counselor works with an individual to first identify the problems and then to refer the individual to the right level of care based on what their specific needs are. So then we have an array of services available that span the continuum of care from less intensive outpatient services to more intensive or highly intensive residential programs. So some of the services that we offer include individual, family, and group counseling, psychiatric evaluation and follow-up, employment supports, and case management. And case management is our core service that we offer and what differentiates us from other behavioral health care providers in the community.
Okay, so we're going to have a whole segment on case management, so we can't. So what kind of, now somebody just calls the same numbers to access adult services, or there, and do the adults have their own, like, are there certain people who deal with kids and then there are people who deal with the adults, or are they the same clinicians? How does that work?
We typically do have different staff that deal with the youth services versus the adults.
Okay.
The numbers are the same. I think Daryl reviewed some of them. We have walk-in services at our Merrifield Center.
Okay.
One of the things we think is really important is to make things as easy as possible for the community at large. When you're having a mental health issue or substance use issue, the last thing you need is a complicated system.
Right.
So the easiest thing is you just walk in Monday through Friday, 9 to 5 at the Merrifield Center, and we're able to kind of take it from there.
So what happens, but what happens if, because, 9 to 5 I'm working, right? And I can hold it together 9 to 5.
Mm-hmm.
But it's that 11 o'clock at night, it's that 2 in the morning. I mean, what happens to somebody who has a crisis then? Do you just have to wait till 9 in the morning? I mean, what's that? I mean, we have emergency people or something, don't we?
Yes, once they're seeing somebody, certainly there will be a plan in place. That's one of the things the clinicians will do, is develop a special plan. What do you need? What services can you access that will be helpful to you? But we have emergency services at Merrifield 24 hours a day, 7 days a week. So if an individual is suicidal, they can walk in, they can call. They can call 911 and certainly ask for a CIT trained officer, and the staff there will assist. So we also have our detox center. That's also available 24 hours a day, 7 days a week. So people could call detox if it's a substance use emergency.
So they do that separately. They should call that. There's a separate number for that as opposed to sort of this general number that we've heard about?
Yes, detox is 703-502-7000, and they deal with the substance use emergencies.
Okay.
The psychiatric emergencies are at the Merrifield Center.
So the substance abuse, is the detox alcohol or is it also drugs? I mean, what does detox mean in this context?
Detox is from alcohol or drugs, and as you've heard, the opiate problem is very much hitting our community. So we're certainly working with individuals with opiate addiction as well.
But people with opioid problems, I always thought if there was somebody who had been taking opioids, you just call 911 and take them to the hospital. You wouldn't, the CSB services would be sort of after that initial crisis is over, right?
Well, certainly if they're overdosing, you want to take them to the hospital.
Okay.
But if they're just using opioids, they may need treatment to help get off the opioids. The hospital's not going to see that as an emergency at that moment.
Oh, I
but
see.
we would be working with the individual to figure out what do you need to do to begin your path to recovery.
Okay, and there's an actual place in Fairfax that you go for these detoxing?
Yes, we have a residential detox program. We also have an outpatient detox program. At the residential program, you would come and stay up to about 7 days.
Okay. I thought detox took longer than that. I always hear detox is like a 30-day thing. So what happens after the 7th? Are people really detoxed in 7 days?
Yes, there's the initial phases of detox, and then there's post-acute withdrawal. But the initial phases of detox are over between 7 and 10 days, and they're physiologically relatively stable. But the ongoing needs will keep going after that. And our goal is to move them from the detox program into ongoing services so they can address their issues long term.
Okay, and so these residential programs that CSB does, are those detox houses, or what are those residential programs about?
We have residential treatment programs, so they would be addressing the issues of addiction, helping the individual develop some recovery skills, helping them practice the skills, getting them connected with resources that they would need to move further, including employment, certainly the case management. We also have psychiatric assessment and evaluation, and then we also do a lot of work with primary health care as well.
So are there people that the CSB can't help? I mean, if you're in this is probably a bad question to ask, but if I'm really having a crisis and I show up at the CSB, are you going to lock me up? Is I guess the question that I would think that somebody would worry about. I mean, do you show up? Do you do that? Do people end up locked up?
Our goal is certainly not to lock people up. We're not law enforcement, so that's not our job.
There are psychiatric hospitals. Right. I mean, do you do referrals over to them for the people who are really in desperate need?
We do, certainly when it's an imminent crisis. But we really do our best to work with people and meet them where they are in their recovery and to engage them. And that's one of our specialties. And in fact, we do actually have quite a few specialty outreach teams who will go out into the community to work with someone if they are concerned about coming into services. So we have, for example, our mobile crisis team. Peggy mentioned a detox diversion team. We also have homeless outreach teams that will go out into the community where individuals are and just offer them bus tokens and lunches and sleeping bags to start that engagement process, because you're right, we are concerned that sometimes people don't want to come into the mental health center. We also have a program for assertive community treatment team at the Gartland Center, as well as intensive case management teams that are throughout the county.
So what's an assertive management team, or whatever that was?
So that is a team that provides wraparound services to an individual in their homes or in the community, and it's a team-based approach. So they have peer support counselors on the team, they have nurses on the team, and they approach working with the individual from a team-based approach. And then they work, I believe, 7 days a week. They provide services to individuals in the community.
Okay, all right, so there's no excuse. If something's available to you every day if you end up with a crisis. So if people are, and I want to go back to the suicide issue because that's a big concern, and we talked a little bit about it with Lynn. How prevalent is that in the adult community? I know I read a lot about it. You know, the schools do the survey and you get all of that. Yeah. What's it like in the adult community? Is that a big issue?
It is. So we know that suicide is a major public health concern right now, and the CSB is doing, everything we can to work hard to address the issue. When individuals are suffering, we know that the best way to help them is to instill hope, and that's what our staff do the best. When they come in for treatment, we offer screening tools that alert us to when an individual is at high risk for suicide, and then we provide training to our staff and provide evidence-based treatment that have proven outcomes for reducing suicidality. But getting someone into treatment really is the first step because we know that treatment is effective and recovery is possible.
Okay, and is this, I had read somewhere, I don't know if this is true, but I had read somewhere that there is a lot more suicide among older people now, the 50 and 60-year-olds, and somehow people are getting depressed at that stage.
Yes, you are correct. And we do have an older adults and their families program that provides specialized treatment and case management to our older adults to meet their unique behavioral health and cognitive challenges. And we do provide that service in the community and primarily in people's homes to assist them because they may have transportation or mobility barriers that prevent them from coming into office-based services. But we do address issues like social isolation and depression, and we also try to provide a lot of support to the caregivers and as well as to promote as much independence as possible, as we know that people really, really struggle with all the complex challenges of aging.
Right, and it would be, hope is hard to instill, I would think, in some folks. If their family is gone, their friends are gone, that's got to be a unique set of challenges as opposed to somebody who's younger who you can sort of, you got a longer term for hope to take hold. So what does the family do? And we've only got 10 seconds, but what does the family do if you can't get somebody to come in for treatment? If somebody's got substance abuse or mental health issues, what can the family do?
I think it's really important to involve the family as quickly as possible. They can educate themselves, they can get referred to family services themselves so they are better able to handle the crisis as well. And certainly we can then try to help them outreach to their family members.
Okay. Well, good. So there's something for everybody. I want to thank you for coming and talking to us about the adult services that are available at the CSB.
Thanks.
Thank you.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
So how was work?
It was 1,300 hours. My math class from 302 was in the trenches. Davy Roth had it the worst. Fractions were coming at him left and right. He just didn't get the damn things. 2 days ago, I tried to teach him what 1/4 of 1/2 was using different sizes of blocks. Yesterday, I tried again by dividing up pizza. Both missions failed.
Oh, no.
But today, I was ready. I created a combat math game where the only way to beat the enemy is to out-fraction them. Davy conquered every last denominator. My game was so successful, the principal is deploying it to math squadrons all over the school.
Anywho, how was your day?
Oh, today my boss treated the office to salad wraps.
Salad wraps.
No.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
We're back to the Inside Scoop. Here again, your host.
Almost over. Welcome back. I'm Bettina Lawton. This is Inside Scoop, and tonight we are talking about the Community Services Board. And we are going to talk this segment with Victor Mealy. He is the Director of Support Coordination Services for Developmental Disability Services at the CSB. He is a licensed clinical social worker. He started his work with the CSB in 1985 as a mental health therapist and provided on-site and outreach behavioral health services to homeless individuals living in the shelters or in unsheltered situations. I guess that means the woods, right? Yes. Along Route 1 in Fairfax County. He has worked in inpatient, outpatient, residential, private practice settings, providing clinical services to families, youth, and adults. He has a Bachelor of Science degree from Georgetown University and holds a Master's in Social Work from Smith College School of Social Work. So welcome, Victor.
Thank you so much for the opportunity.
Absolutely. So I will confess that I can do this because you're a licensed clinical social worker.
Okay.
That I don't understand support coordination. And so I really am hoping that you can explain to me what is that. So we've heard from our other guests that we have all these different services. So what does support coordination do? Do you just say, go here, go here, go here? I mean, what's that all about?
So support coordination really is a set of services to provide supports for the individual who has a developmental disability.
Okay.
So that staff person is a professional, paid staff person who's really going to collaborate with the individual and the family to make sure that those services are in place. So to access those services, to monitor those services. Your audience might be more familiar with the term case management or case manager.
Okay.
So the precepts are very, very similar. You know, advocacy, linking, referral, monitoring, and ongoing assessment. So it's a dynamic, ongoing process. And the support coordinator, we like to say, is at the hub of the wheel with the individual. So partnering with the individual and the family and those natural support, people, the family, caregivers, teachers, other people that are in the individual's life. So that support coordinator is there really to make sure that that plan is in place and is active and is changing and is dynamic. As the individual's life changes, you want that individual supports plan to change as well.
So let me see, is this the kind of thing where you've got somebody at the CSB who is providing some kind of services? So is the coordination with other CSB services, or is it with people out in the community? Is it a little bit of both? I mean, how much, because I would have thought that whoever is in the CSB knows what's available in the CSB. So how does that work?
So our individuals need a range of services: primary health care, housing, employment, all of those things. So those services are all out in the community.
Okay.
So the Community Services Board employee is going out and making sure that individual knows about those services, that those services are appropriate for that individual, that it meets his or her needs and desires.
Okay.
So it's really a person-centered process, and we'll talk about that as well, in terms of what does that individual desire for his or her life.
But I thought these people were developmentally disabled or substance abuse. So is the coordination only for the developmentally disabled people, or does it do substance abuse? And in either case, when you say what the person wants, I thought they were disabled or substance abusers, so how much do they know?
So everyone has a right and a desire to be empowered about their own life. Everybody has desires. Everybody has wishes. Everybody hopes and dreams. And so the support coordinator's job really is to work with that individual, their caretakers, their guardians, their families, to elicit those hopes and dreams and desires and what's important to them and for them. So that's really part of that individualized process where you get to know the person. You get to know all the support providers. We have a wonderful community of community providers who provide housing and employment and day supports. And so we work as a team, as a village, that surrounds that person to really get to know what that person wants and desires. So everybody can communicate about their life.
Okay. So let me ask you this, because you used a phrase, day supports. What is a day support?
So some individuals have employment opportunities and some individuals have day opportunities as well. So there's a range of vocational options that our community providers provide for individuals with developmental disabilities.
So your support coordinators then know about all the other things that are available in the community. So if you've got somebody who says, boy, this is what I really want to do, artsy, I want to get, have those kinds of things. These folks would know how to find appropriate places for them to be able to do that. Is that the idea?
Yes. So we're always going out looking for opportunities for individuals. There's a wonderful grapevine with the providers, and so we're always talking to each other. I see emails all the time. Do you know of this? Do you know of that? And so I have over 100 staff, and so they're always communicating about opportunities in the community, and we have great communications with our community providers as well.
So people who have developmental disabilities, so is that, what is a developmental disability?
So developmental disability really has a definition that's in the state code.
Okay.
So it's a diagnostic, has to be evaluated diagnostically. So a psychological or any other evaluation.
So it's not just physical.
It's not just physical.
Okay.
And so it can be cognitive, and it can also be physical components to it as well. And so that if it's an intellectual disability, the onset has to be diagnostically defined before the age of 18.
Okay.
For the other developmental disabilities, excluding intellectual disability, it can be before the age of onset of 22. So our staff does intake and eligibility. We have an amazing team of individuals who do that. And so an individual will call in or a family member will call in, and we'll take them through the intake and eligibility process. We look at functional, we look at diagnostic, and those are the areas we look at in terms of defining whether the person qualifies for developmental disability services.
Okay, so the kind of people who are eligible, are they just those folks within those age ranges? How big of an age range do you serve in your support coordination?
So we serve, everyone,
Okay.
so but you have to document the disability at those critical moments. Okay. So again, for ID, it's before the age of 18, and then before other developmental disabilities, it's before the age of 22 is the onset. Once you do that, then you're open for eligible for services as well. You also have to have functional deficits, so there has to be some need for you to be there as well in areas of learning, mobility, self-care, self-direction, expressive language. So you have to have functional deficits as well as the diagnostic eligibility criteria as well.
Okay, and so how does somebody, if you think that you or your spouse or your kids have an issue, who do they call? Is it the general number at the CSB, or do you all have your own number?
So our department has our own number, 703-324-4400, and just ask, say, I don't know, I would like to speak with someone about this issue, and we'll get you to the right person. Mostly it'll go to our intake staff and eligibility staff, and they are amazing at sifting through this process with people and holding their hand through the process. It's a pretty complex process, but don't let that daunt you. We will get you through it.
And do they all have to come out to Merrifield, or do you have places around the county?
So primarily we go through at the Penino building, which is
it's a Penino.
At the Penino building.
Okay.
That's where my intake staff.
Okay.
But we do have the ability to go to the schools. We have the ability to follow people into the community. One major thing that I didn't mention, support coordination is a field-based service. So we go to people where they live, where they play, where they recreate, where they work. So we will go to you if that's necessary to get that, especially that initial eligibility determination done as well.
Okay. And then is the support coordination just for the individual who has the disability? What about the family? I would think that there's a lot of family need. Do you also do that, or do you just do the individual?
So it's the whole system that we're working with. So we find family members who have needs and we'll refer them to appropriate services as well. So we work with everybody, because those needs will impact the individual that we're serving as well.
Well, that's what I wondered, is how strict of a line gets drawn, because it would seem that that would definitely have an overlap.
Yeah, we make referrals, so if we see a need, a behavioral health need for a family member, we'll make sure that we link them with the rest of the CSB system or the Department of Family Services for entitlements and things like that.
So it's really sort of a entry point into finding the other services that you need, so they can call the CSB and your people are going to be able to get them where they need to go.
Right. Our primary function is really to look at the person who has a developmental disability, where we certainly acknowledge that there are other needs in the family, and we'll get those referrals done as well.
Okay. Now, you had mentioned housing. Is there special housing that the CSB has, or is it you referring people out to housing providers? How does that work? Because we heard in the last segment about a detox facility for people. I mean, what does the CSB do in terms of that kind of need?
So we work with a wide range of providers, who provide group home situations and residential options for individuals. We also work with the state around state rental assistance programs, and we do those referrals as well. So we just had a housing fair, and so we had a wonderful array of providers to come to the government center and put on housing for people with developmental disabilities, and so it was well attended, and so we're really out there looking at those options around housing and employment as well.
Well, let me ask you about older people or people who don't have any family that can help them, who are disabled. Do you help those kinds of people?
So if a person is in our services, we wrap around them, so we are going to be that person, and hopefully we can develop other natural supports in the community as well to support that person. So we're looking at paid supports, and we're also looking at natural supports in the community as well. Our residential providers, our private providers do an amazing job of supporting people in homes for many, many decades. They become the family for those individuals who don't have those kinds of, natural supports readily available to them as well.
Wow, okay. So it sounds like this is people with developmental disabilities, this is a place they've got to go to, that if they are concerned about how do they find help, the call to your section, to your support coordinators is the first step for them.
Very, very much, very key.
All right. Well, I appreciate you coming, Victor. I know that this was also your maiden voyage, and so we've got all these people now who are totally comfortable coming on, and we're always interested in what's going on because people need help. And it is good to know that in Fairfax County, the Community Services Board and all these excellent folks are there to help you. So call, go to the website, get some help. Thanks.
Thank you very much.